Hey, what's up, everybody? This is Dr. Craig Kasper with NYHD and the Institute for Hearing and Balance. We're back again with another episode of the Audiologist at Home episodes. And today we have Dr. Zweig back again. What's up, Dr. Zweig?
Hey, how you doing?
I'm doing great. How are you today?
Very well. What episode are we on now?
This one, I think, is 32.
Wow.
Yeah. It's amazing how time flies when you're having fun, right?
Yes. For sure.
Yeah, but as you said, we've been doing these episodes since the shutdown started, and we've been doing an episode pretty much every day. So for anybody who's watching this particular video, catching it for the first time, there's an entire library of Q&A, questions and answers, that we've gone through, common things that we see in our practice, also questions that people out there in the world of YouTube and the internet have sent us, that we've done our best to answer in the world of hearing and balance issues. So yeah, we have a whole library, which is kind of cool.
It is. I go back and watch them sometimes.
Yeah, I critique myself all the time. It's not healthy. So, all right. So today we have a really interesting question for you. We're going to back away from the hearing related stuff for a while.
Okay.
And the question that came through is, what are some of the most common balance disorders that are out there? So this is a balance question. Usually you guys throw this at me, but I'm going to throw it at you today.
Yeah, let's see how I do. So balance disorder in general is a condition that's going to make someone feel like they're moving, spinning, floating. Some people are describing feeling like they're tipping over. This can happen when someone is lying down, when they're sitting, or even when they're walking. And it's probably the most common reason why older individuals might seek help from a doctor or go to the doctor is for some type of balance issue. For normal balance to occur, there are many body symptoms that have to work. Systems that have to work together. This includes the muscles, the bones, the joints. Then this also includes the vision, as well as the balance organ in the inner ear, and sometimes even the heart and blood vessels. So when one of these systems are not functioning well, that's when a balance problem occurs. And most balance problems, and what I'm going to focus on today, is really happening at the end organ in the inner ear. That's where the balance center is occurring. Generally, these balance disorders should be diagnosed with a full case history, a comprehensive audiological evaluation, and then what we do also in our office is a vestibular assessment so that we can determine the integrity of each inner ear and kind of break down what we think is going on. So that's kind of how these are diagnosed. So the most common balance disorder, probably about 20 to 30% of people will experience this type, is called benign paroxysmal positional vertigo, also known as BPPV. This is described as a brief, intense episode of vertigo that is triggered by a change in position of the head. So it's usually lasting a few minutes, a few seconds to a few minutes, and once that person gets out of the position, they usually feel pretty okay. When getting, the most common reason why they might describe this is when getting out of bed, when lying down or turning over in bed, sometimes just by looking up or looking down. So I'm going to talk a little bit about just why this occurs, and for each balance disorder, I'll discuss a little bit about why it's occurring. I'm not going to go into too much detail there. The causes of this type of vertigo is we have small crystals in the inner ear. So when someone says, do you have rocks in your head? We actually do sometimes.
Yes, my wife thinks I have a lot of rocks in my head.
Yeah, tell her you do have rocks in your head.
Thanks, Dr. Zweig. Appreciate that.
You're welcome. So small crystals within the inner ear break loose from their correct position, and they find themselves within another part of the balance center. And this, therefore, sends false impulses or incorrect information to the brain about the head's position. So that's why this generally occurs when we lay down or change position of our head, and results in feeling okay when we put ourselves back into a normal position. This generally results for younger people with, could be from a head injury, but generally it can occur just as we get older. So treatment, not really going to get into too much about the treatment, but the goal to treat BPPV is just to bring those crystals back in the part of the balance system that they belong. So it's by a position of specific head and body movements that either an audiologist, an otolaryngologist, or a physical therapist will perform.
Gotcha.
So that's the most common type of balance disorder. Second type.
I guess the good thing with BPPV is that it's fixable. And as long as we know what it is, we can figure out a way to fix it then.
Yeah, pretty quickly too, I'd say.
Sure.
So the second most common is called labyrinthitis. And this is an inner ear infection causing structures, I mean specifically the labyrinth in the inner ear, which is housing both the balance and hearing centers, to become inflamed. So this entire system becomes inflamed. It's usually resulting or as a result of a viral infection like an upper respiratory infection or the flu. Because it's impacting the entire labyrinth in the inner ear, it's going to impact both the balance and the hearing. And I think that's a really important point because that's going to differentiate from the third most common vestibular disorder, which are sometimes interchangeable, or many people think they're interchangeable. Mm-hmm. So symptoms include vertigo, so room spinning sensations. Sometimes you feel nauseous or sick, hearing loss, ringing in the ear. Those are going to be your common symptoms. It generally happens suddenly and can go away over a series of days. So some people just wait and watch and see what happens. If it doesn't, then we do treat it with physical therapy because we call that a lack of compensation. So then we have to treat the balance system or treat the person how to compensate for that balance disorder. So that's the second, and that's called labyrinthitis.
And that comes along with, as you said, hearing loss is the differentiating factor for labyrinthitis.
Right, because Excellent. Then the third is called vestibular neuritis. And although very similar to a labyrinthitis, vestibular neuritis is going to impact or cause an inflammation in the vestibular nerve. So it's not necessarily impacting the hearing organ or the hearing structures, and therefore does not cause hearing loss, but causes similar symptoms such as vertigo, the spinning. It could be mild dizziness to violent spinning. Usually it is associated with some nausea or vomiting. That's pretty common. Vision difficulties. People in this case will gradually recover over several weeks, but the same as labyrinthitis. If they do not recover, we call that lack of compensation, and then physical therapy is generally the treatment for that.
Gotcha.
And then the last, and probably the least common out of the four, is called Meniere's disease. And I have spoken about Meniere's briefly in other videos. So Meniere's disease is a change in fluid volume within the parts of the labyrinth. So that labyrinth in the inner ear has fluid running through it. And this increase in fluid causes a feeling of pressure in the inner ear. It causes vertigo because it's changing the natural impulses to the brain. And it causes fluctuating hearing loss. So we generally see a fluctuating low frequency hearing loss during an episode of Meniere's disease when the inner ear is inflamed with fluid or overabundance of fluid. That's when we'll see the hearing loss in the low frequencies and a roaring tinnitus or roaring ringing in the ear. Low frequency hum is usually described as well. This will last for hours, sometimes days. For treatment in this case, it's not generally suggested physical therapy because of the fluctuating component. Generally, otolaryngologists or otologists will prescribe a diuretic to reduce some of the fluid in the inner ear, low salt diet modifications such as lowering or limiting caffeine, chocolate, or alcohol. In a very rare case, they will, if it's a severe case, they will implement or inject gentamicin in the middle ear that will slowly drain into the inner ear. So the goal in that case is actually to destroy the balance system, so then we can use physical therapy to compensate for that. So That's an extreme case, as I found some research on.
Yeah.
So those are your most four common.
So sum up, BPPV, benign paroxysmal positional vertigo. Those are crystals floating around in our heads. It's very common. happens as a result of head trauma, normal aging of the system, sometimes viral. I believe there's also some connections with vitamin D deficiencies depending on part of the year.
Yeah.
Good thing is that if that's diagnosed appropriately, it's easily fixed by a series of head body exercises that can be done by us, by ENTs, by physical therapy. You have labyrinthitis, which is viral, usually the cause in nature, that impacts not only the balance part of the inner ear, but also the hearing part of the inner ear. You have vestibular neuritis, which then just is a viral component that impacts the balance nerve. And then the last one is Meniere's, which is an excess amount of fluid that builds up in the inner ear for whatever reason, which we're not really 100% sure if it's lack of absorption or too much production of it. That's something that has a number of different potential medical treatments and dietary treatments as well. At the end of the day, for all of this, what you're telling us is that in terms of really trying to appropriately diagnose this, case history is critical for all of us. Medical evaluation and full vestibular balance assessment through audiology, just to get a really good picture of what's going on.
Yeah, you seem to know a lot.
I learned from you.
Not sure.
No, that was great information, though. I think that that's really important because there are so many patients out there that come to us and also other audiologists and ENTs and their doctors all over the country and all over the world, where it's sometimes very difficult to determine what might be causing the balance problem for the person. And what might be treated is not necessarily what the cause is. So for us to help to start to break things down, help people understand what symptoms might relate to what parts of the inner ear, ultimately that's going to help them get to an end point faster, so they just feel better faster. So
Yeah. So is the goal of balance.
always the goal of balance. Yeah. So great information today, Dr. Zweig. And if you guys have any further questions out there for us, you can send them to info@newyorkhearingdoctors.com, info@newyorkhearingdoctors.com. And we're going to do our best to continue answering these questions for you. With that, I'm going to say thank you very much, Dr. Zweig. I really appreciate all the great information today. Really, really important information. So thank you.
My pleasure. See you soon.
Take care. We'll talk soon.